Have you ever experienced that nagging groin pain that just doesn't seem to want to go away? In today's Muscle Monday, we're going to talk about the adductor muscle group, which is the group of muscles that lives on the inside of your leg here, what I call groin pain, where you feel it here. Some people will talk about groin pain and be referring to the front of the hip. If you're getting pain there, that's not this muscle group. That's a couple other things that we need to look at. But the adductor muscles all start on the pelvis and then run down and attach to the femur. There's 5 different muscles: the pectineus, adductor brevis, adductor longus, adductor magnus, and then the gracilis. Primary function of these muscles is to do adduction, adduction, which means moving the leg toward midline. So I always think of it as adding to the midline, as opposed to abduction, which is taking the leg away from midline. And then they also play a very important role in stabilizing the pelvis while you're walking in a single leg stance, or anytime you're on a single leg. They help with that pelvis stabilization. Clinically, the main thing that I see in here is a good old-fashioned adductor strain. So just where there's been some damage to that muscle tissue and it takes a little bit of time to heal up. I also see the occasional time where it's just spasmed up, there's no actual tissue damage. That's kind of the main clinical thing that I see in here. And then also how the tightness of these muscles, the chronic tightness of these, can affect the rest of the pelvic function and motion and biomechanics, and then how that can play a role in different areas like the low back or down the kinetic chain as well. Thanks for tuning in to learn about your groin muscles. On Thursday, we'll go through a nice couple stretches to help loosen those up and see if that brings some relief for some of that nagging groin pain that you deal with.